The Identify study is basically a collaborative study that's looking at patients presenting to secondary care with hematuria. The problem with hematuria is that it can be very resource intensive, burdensome, expensive, and also invasive to patients. And our study hoped to look at ways to improve the diagnostic strategy of these patients so that we can efficiently diagnose cancer in these patients. With 11,000 patients that were collected over a year, which I think is a phenomenal achievement. And that was in 28 countries around the world, in 110 centers. So it really does show the power of collaborative study, and I think that's one of the future paths really for research. We have a variety of prevalence across the world, as would be expected. There's approximately an overall prevalence of 18% in bladder cancer, 1% in upper tract urothelial cancer, and 1% in renal cell carcinoma.
The really exciting and unique thing about the Identify study is that with 11,000 patients, we also collected a real depth of data for each one of those patients. So in contrast to many studies in hematuria that have gone before, we have detail on demographics, on the symptoms that the patients presented with, and a lot of detail and very carefully collected data around the investigative tests and test adequacy, which gives the study a real rigor for going forward to really identify personalized approach to hematuria investigation. And just to pick up on some things that Sinan said, for instance, the variation that we see across the world in how hospitals are investigating hematuria, even for instance the proportion of non-visible hematuria that clinics are seeing varies hugely from less than 10% in some centres up to 40 or 50% in other centres. So it's clear that across the world the approach that hospitals are taking to the investigation of hematuria is hugely different. And we really hope that the Identify study will be able to make recommendations for the individual patient because of the depth of data that we've collected. And that's a real tribute to all of our 450 collaborators across the world who put this data into our database.